Treatment will depend on the type and stage of the colon cancer. A doctor will also take the age, overall health status, and other characteristics of the individual into consideration when deciding on the best treatment option. There is no single treatment for any cancer. The most common options for colon cancer are surgery, chemotherapy, and radiation therapy. The aim of treatment will be to remove the cancer, prevent its spread, and reduce any uncomfortable symptoms. Surgery. Share on Pinterest surgery as one possible treatment for colon cancer. Surgery to remove part or all of the colon is called a colectomy. During this procedure, a surgeon will remove the part of the colon that contains the cancer, as well as some of the surrounding area. For example, they will usually remove nearby lymph nodes to reduce the risk of spreading. The surgeon will then either reattach the healthy portion of the colon or create a stoma, depending on the extent of the colectomy. A stoma is a surgical opening in the wall of the abdomen. Through this opening, waste passes into a bag, which removes the need for the lower part of the colon. This is called a colostomy. Other types of surgery include endoscopy. A surgeon may be able to remove some small, localized cancers using this procedure. They will insert a thin, flexible tube with a light and camera attached. It will also have an attachment for removing cancerous tissue. Laparoscopic surgery. A surgeon will make several small incisions in the abdomen. This may be an option to remove larger polyps. Palliative surgery. The aim of this type of surgery is to relieve symptoms in cases of untreatable or advanced cancers. A surgeon will attempt to relieve any blockage of the colon and manage pain, bleeding, and other symptoms. Here, learn more about endoscopy. Chemotherapy. During chemotherapy, a cancer care team will administer medications that interfere with the cell division process. They achieve this by disrupting proteins or DNA to damage and kill cancer cells. These treatments target any rapidly dividing cells, including healthy ones. These can usually recover from any chemotherapy-induced damage, but cancer cells cannot. A cancer specialist, or oncologist, will usually recommend chemotherapy to treat colon cancer if it spreads. The medicines travel through the whole body, and the treatment will take place in cycles, so the body has time to heal between doses. Common side effects of chemotherapy include hair loss, nausea, fatigue, vomiting. Combination therapies often use multiple types of chemotherapy or combine chemotherapy with other treatments. Radiation therapy. Radiation therapy kills cancer cells by focusing high-energy gamma rays on them. A cancer care team may use external radiation therapy, which expels these rays from a machine outside of the body. With internal radiation, a doctor will implant radioactive materials near the site of the cancer in the form of a seed. Some metals, such as radium, emit gamma rays. The radiation may also come from high-energy X-rays. A doctor may request radiation therapy as a standalone treatment to shrink a tumor or to destroy cancer cells. It can also be effective alongside other cancer treatments. For colon cancer, cancer care teams tend not to administer radiation treatments until the later stages. They may use them if early-stage rectal cancer has penetrated the wall of the rectum or traveled to nearby lymph nodes. Side effects of radiation treatment may include mild skin changes that resemble sunburn or suntan, see vomiting, diarrhea, fatigue, appetite loss, weight loss. Most side effects will resolve or subside a few weeks after completing treatment. Diagnosis. A physician will carry out a complete physical examination and ask about personal and family medical histories. They may also use the following diagnostic techniques to identify and stage cancer. Colonoscopy. A doctor will insert a long, flexible tube with a camera on one end into the rectum to inspect the inside of the colon. A person may have to follow a special diet for 24-48 hours before the procedure. The colon will also require cleansing with strong laxatives in a process known as bowel prep. If the doctor finds polyps in the colon, a surgeon will remove the polyps and refer them for biopsy. In a biopsy, a pathologist examines the polyps under a microscope to look for cancerous or precancerous cells. A similar procedure, called a flexible sigmoidoscopy, allows a doctor to examine a smaller portion of the colorectal area. This method involves less preparation. Also, a full colonoscopy may not be necessary if a sigmoidoscopy does not reveal polyps, or if they are located within a small area. Double contrast barium enema. This X-ray procedure uses a liquid called barium to provide clearer images of the colon than a standard X-ray. A person must fast for several hours before undergoing a barium X-ray. A doctor will inject a liquid solution containing the element barium into the colon through the rectum. They follow this with a brief pumping of air to smooth over the barium layer to provide the most accurate results. A radiologist will then conduct the X-ray of the colon and rectum. The barium appears white on the X-ray, and any tumors and polyps will appear as dark outlines. If a biopsy suggests the presence of colon cancer, the doctor may order a chest X-ray, an ultrasound, or a CT scan of the lungs, liver, and abdomen to assess the spread of the cancer. Following diagnosis, a doctor will determine the stage of the cancer based on the size and extent of the tumor, as well as the spread to nearby lymph nodes and distant organs. A cancer's stage will determine the treatment options and inform the outlook. Prevention. There is no guaranteed way to prevent colon cancer. However, some preventive measures include maintaining a healthy weight, exercising regularly, consuming plenty of fruits, vegetables, and whole grains, limiting the intake of saturated fats and red meat. People should also consider limiting their alcohol consumption and quitting smoking. If you like this video, kindly subscribe in this channel. Baby Time FYI. Thank you.